Imagine walking down a perfectly safe street when a sudden weight drops onto your chest. Your airway clamps shut. Your heart hammers against your ribs like it's trying to escape. Your biological survival systems are signaling that you are about to die. You are rushed to the emergency room, convinced you are suffering a fatal heart attack. The readout tells a different story. The tracing is steady. Every blood test comes back normal. Your physical heart is fine. The medical staff unhooks the machines and sends you home with a brief conclusion. Your body is healthy. You were experiencing anxiety. Almost immediately, the concern from those around you evaporates. Because the tests found nothing, people start treating the event as a performance. They label you as dramatic or assume you are faking a crisis to avoid your responsibilities. This is the central struggle of the condition. If you break an arm, an X-ray proves your pain, but no machine can image the suffocation and the chest pain you just endured, even though those sensations were entirely real to your nervous system. You have survived a panic attack, a severe neurological event that traps victims in a nightmare that remains invisible to everyone else. Chemically, a panic attack is a massive, unprovoked release of adrenaline into the bloodstream. It occurs in an instant, often with no warning or external trigger. This diagram shows the biological difference. On the left, a heart attack is caused by a physical artery blockage cutting off blood flow. On the right, during a panic attack, the heart is healthy, but the brain is firing erratic electrical signals that flood the body with stress hormones. The brain's evolutionary survival mechanism has misfired. It is perceiving a deadly threat where none exists. This chemical overload takes over the autonomic nervous system. It manufactures the sensations of cardiovascular failure, resulting in severe chest pressure, a racing pulse, and intense dizziness. The timeline of this alarm is specific. While a heart attack worsens without medical intervention, a panic attack peaks within 10 to 20 minutes before the adrenaline burns off and the symptoms recede. Enduring this has nothing to do with a lack of courage. Your body is executing a life-or-death survival response. It is simply doing it at the wrong time. The physical toll is high. Victims experience a respiratory trap, a sensation of choking and profound air hunger. It feels like suffocating in open air. The limbs go numb. The body shakes with uncontrollable tremors that mimic the loss of motor control seen during seizures or sudden paralysis. Then comes derealization. The surrounding world feels fake or distant, as if viewed through a screen. The psychological fracture is so extreme that victims become convinced they are losing their sanity. These attacks can even strike during sleep. A nocturnal panic attack jolts the victim awake with the sensation of falling from a great height. These symptoms represent an extreme endurance test for both the body and mind. It is a neurological hurricane that cannot be reasoned away. Surviving the adrenaline spike is only the beginning. The fear of the next attack becomes a persistent shadow over daily life. If the first attack happened in a specific place, the brain creates a conditioned fear response. It wires the memory of that mundane environment, like a city bus or a theater, directly to its internal danger center. This triggers avoidance behavior. To stay safe, the victim begins cutting out risk. They stay away from crowds, avoid traffic jams, and refuse to travel far from a hospital. This shrinking of the world is called agoraphobia. The victim maps out a safe zone, which rapidly contracts until they feel they cannot leave their own house. Society often mistakes this isolation for a lack of ambition. The reality is that the victim desperately wants to live normally, but stepping past the front door triggers a biological alarm that the brain cannot ignore. The long-term horror of panic disorder lies in this aftermath. It builds an invisible prison, slowly severing the victim from the rest of the world. Because this prison is invisible, well-meaning people often try to help with logic. They offer advice like, just relax, or be brave. These phrases have no influence over someone in the middle of a phobic reaction. During an attack, the brain's high arousal state prevents it from processing external logic. The alarm center effectively shouts over the parts of the brain that handle reasoning. These episodes are often the culmination of accumulated emotional pressure and long-term stress. While the attack itself arrives without warning, the neurological system has been building toward this explosion for years. Recovery is a medical process. It is not resolved by a single pill or a week of rest. Healing requires professional psychiatric and psychological treatment, involving therapy and exposure exercises that can span years. If you know someone suffering from this, there are basic rules of support. Never accuse them of faking it, never mock their fears, and never forcefully push them out of their safe zone. You cannot reason with a neurological panic response. The effective way to help someone break free is to offer them patient, unconditional support, free of judgment or demands.